Today, we will discuss blood clots, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. A thrombus is a blood clot that forms in a blood vessel and can block blood flow. It can occur in veins or arteries and may lead to serious health issues, such as a heart attack or stroke, depending on its location. Symptoms of a thrombus. The signs of a thrombus can vary depending on where it forms. Deep vein thrombosis DVT, often in the legs. Swelling in one leg, pain or tenderness, especially when standing or walking, warmth in the affected area, red or discolored skin, pulmonary embolism if the thrombus travels to the lungs, sudden shortness of breath, chest pain that may worsen with deep breaths, rapid heart rate, coughing up blood, arterial thrombosis in arteries, sudden pain and weakness in a limb, coldness in the affected area, loss of function in the affected limb. If you suspect you have a thrombus, it's important to see a healthcare professional. They may use the following methods for diagnosis. Ultrasound, commonly used for DVT to visualize blood flow. CT or MRI scans, used for detecting clots in the lungs or other areas. Blood tests, such as D-dimer tests, which can indicate the presence of a thrombus. When to seek medical attention. Seek immediate medical help if you experience any symptoms of a thrombus, especially if they occur suddenly or are severe. Prompt treatment is crucial to prevent complications. If you think someone has a blood clot, here's what to do in simple steps. 1. Stay calm. Keep the person calm and still. 2. Seek help. Call emergency services or take them to the hospital. 3. Do not move them. If it's a serious clot, like in the leg or lung, moving could make it worse. 4. Monitor symptoms. Keep an eye on their symptoms like swelling, pain, or difficulty breathing. 5. Provide comfort. Help them stay comfortable while waiting for medical help. Important, do not give them anything to eat or drink if they might need surgery. In the hospital, if someone has a blood clot, the medical team will typically do the following. 1. Assessment. They will check the person's symptoms and may perform tests like an ultrasound or CT scan to confirm the clot. 2. Medications. Blood thinners. They may give medications to thin the blood and help dissolve the clot. They might provide pain relief if needed. 3. Monitoring. The person will be closely monitored for any changes in their condition. 4. Additional treatments. Thrombolytics. In some cases, they might use stronger medications to break up the clot more quickly. Surgery. If the clot is very serious and doesn't respond to medication, surgery may be needed to remove it. 5. Follow-up care. After treatment, they will discuss ongoing care to prevent future clots, which may include lifestyle changes or medication. Here are some commonly used blood thinners and thrombolytics. Blood thinners, anticoagulants. 1. Warfarin, Coumadin, an oral anticoagulant that requires regular blood tests to monitor its effect. 2. Direct oral anticoagulants, DOACs. Apixaban Eliquis, taken orally, usually twice a day. Rivaroxaban Xarelto, taken orally, usually once a day. Dabigatran Pradaxa, an oral anticoagulant that is taken twice a day. Edoxaban, taken orally, usually once a day. 3. Heparin, a fast-acting injectable anticoagulant used in hospitals, often given intravenously or subcutaneously. 4. Low molecular weight heparins, LMWH. Enoxaparin, Lovenox, an injectable anticoagulant used for DVT and other conditions. Thrombolytics, clot busters. 1. Alteplase Activase, a tissue plasminogen activator, TPA, used to dissolve clots in cases like heart attacks or strokes. 2. Redaplase Redavase, another TPA used for treating heart attacks. 3. Tenecteplase Case, a genetically modified form of TPA used for acute myocardial infarction, heart attack. These medications play crucial roles in managing blood clots, and their use depends on the specific condition and patient needs. Always consult a healthcare professional for proper diagnosis and treatment. Now you need to watch my video on seizures or have a look at heart attacks.